Hey Midlifers, welcome to the Midlife Unmasked podcast. I'm your host, Robin Austin, a nurse researcher and educator, and your guide to navigating everything from healthy aging and wellness to big stuff like caring for aging parents, mastering work-life balance, and discovering your next great adventure. So are you ready? Let's do this. A quick note before today's episode. While I'm a professor of nursing at the University of Minnesota, this podcast, Midlife Unmasked, is a personal project and separate from my professional responsibilities at the university. This podcast is intended for informational and educational purposes only and should not be considered professional medical advice. Please consult your own healthcare provider before making any decisions related to your health and wellness. In keeping with my role as a nurse researcher and educator, I'm here to bring evidence-based information to improve overall health and well-being. It is my goal to be a trusted source of information and to build this community where we can all learn, grow, and share together. With that said, let's jump into today's conversation. Hey Midlifers, welcome to the Midlife Unmasked podcast. I'm your host, Robin Austin, a nurse researcher, health enthusiast, and advocate for living your best life in midlife and beyond. On today's episode, we're starting with the basics. I'm super excited for this episode because it really will help us to level set where we are within our health journeys, where we are with our health knowledge, and I'm hoping that this can provide a foundation to build on for future episodes. So it's a new year. We're going to start with the foundational health numbers that I want you to know going forward as a goal to really help us to really engage with our healthcare and understand our numbers of our own healthcare journey. So with this journey, we're going to just start with some numbers that some of it might be old for you, some of it might be brand new, whatever it is, it's okay. We're going to just, again, go back to some of the foundational pieces that I want us to understand about our overall health. So there are 10 overall numbers, and on today's episode, we're going to cover the first 5. So this is part 1 of a 2-part series we're going to be doing to kick off this episode. Again, getting us back to understanding specific things about our health. It's really important to go back and look at our health now that we're in midlife. Unfortunately, I hate to say that, but we're not in our early 20s or our late teens anymore. Health things in our bodies change over time, and it's a good time in midlife to just help us to reset, understand where our numbers are so we can have a baseline for going forward in case something were to change in the future. We are prepared for that, understanding where our bodies are at that time. So from bone density to blood pressure, we're going to dive into it all on the 10 overall numbers that I want you to have a good grasp on for foundational work that we're going to dive into in future episodes, getting into a little bit more deeper topics for our healthcare. So there are 5 numbers that we're going to talk about today in today's episode, and those are blood pressure, cholesterol, blood sugar, our waist size, and our waist to hip ratio and resting heart rate. I kind of combined waist size and waist and hip ratio, so it's a total of 5 for today. And my goal with talking about all of these numbers is really for us to provide you with the tools to help you increase your health span. So we talk about longevity, the number of years in which we live, but health span really will help us to focus on the number of years in which we live in good health. It's not something we always want to talk about, but again, it's one of those things that I think are critical to having a good, solid foundation to understand as we are in our midlife journey. For our foundation, this is going to be something that we're familiar with. Again, this might be some new information for you to build on for future episodes. I want us to have these numbers to be acting like a roadmap for your wellness. I will have links in our show notes. I will have a downloadable table for you that you can fill off and print out if you so choose to write in your own numbers or possible questions that you might have for either this podcast or your healthcare provider if you go in for an annual physical. It's just, again, good ways to kind of keep track of things that you have questions about that you want to maintain and manage. So why is this important? Again, it's to understanding the goal range of what these numbers are, see where you are right now at this point in time, how to test it, and then also smart strategies for managing some of these numbers. We're not going to dive too much into managing the numbers, but just little tidbits, I think, of information to help you kind of get on the road to better managing your own health. So again, super excited for you to be here. Thank you so much for listening, and we're going to dive into our first number here with blood pressure. Why is blood pressure important? You've heard of it before, I'm sure. You go into a healthcare provider, you're going for your annual physical, they take your blood pressure. It's the cuff that goes on your arm. They listen to and measure the pressure that is going on throughout your arteries and your blood vessels. So blood pressure is the force of the blood pushing against the walls of your blood vessels as your heart pumps it around your body. We want to have a good, forceful heart pressure to make sure we're getting all the oxygen and nutrients throughout our body to help us maintain our tissues over time. So normal blood pressure really helps your body get all the oxygen and nutrients. We've heard of high blood pressure, which is not always good because that damages walls of your blood vessels and can over time cause plaques to build up, which again can damage your arteries over time, causing them to narrow. And high blood pressure is a major risk factor for heart attack, heart failure, and also stroke. So high blood pressure, also called hypertension, can cause more damage over time as well. Whereas you have low blood pressure on the lower end, that's not good either because that can cause maybe having you feel faint or dizzy. And you don't want that either because you don't want to worry or risk potentially having a fall if you do get dizzy or faint. So low blood pressure is called hypotension. And these are the two numbers that make up your blood pressure. You've seen it before. It might be a fraction of how it's recorded, but the systolic number is that top number. And the systolic measures the pressure when your heart beats and pushes your blood around your body. And that is called the systolic pressure. And that should be the goal range of that is 120 for the systolic pressure. The bottom number is called diastolic. And this measures the pressure when your heart rests between beats. And it's kind of the resting pressure, so to speak. And that number is 80 is optimal. So your blood pressure optimal number is 120 over 80. Now, if you're like me, I think I have a pretty normal blood pressure. However, when I go into my provider, I get what's kind of called white coat syndrome, where I see the blood pressure cuff. I instantly start getting panicky, like, oh my gosh, is it going to be high? I'm nervous. I'm paranoid. I just have to remember to keep myself calm, 2 feet on the floor, take a few deep breaths. It's a good number to have to really manage your overall health and well-being. So the optimal number is 120 over 80. Don't be like me with white coat syndrome and try to get all nervous because I want to make sure it's in an optimal range. But again, it's a 120 over 80 is the best measurement. And again, it's typically done in a healthcare provider's office when you go in for that annual physical. If you haven't been in a while and you're really wanting to know what that is, I think sometimes a CVS or a Walgreens pharmacy store may have a blood pressure cuff sitting there that you could do. It's a manual machine. You put your arm in it, you hit a button, and it will start to measure the cuff gets tight. So don't panic when that cuff does get tight around that arm. But you can also check if you're really wanting to go get that done. But I would highly recommend you, if you have not been in for your annual physical, I'm going to harp on this all throughout this episode and probably throughout this entire season of episodes, is to really make sure you get that baseline annual physical. I think that's going to be the one best way to kind of ward off some of potential diseases or understanding your health long term, is to make sure we're staying on top of those annual physicals. So I'll get off my soapbox on that, but also smart strategies for managing your blood pressure if it is high. There might be some recommendations for managing your lifestyle, such as your diet. We'll talk a lot about that. Exercise is a key component, sleep, and also managing stress. Those are huge critical factors for managing overall health, but also blood pressure is a component of that. If your provider finds it necessary for you to have a medication, definitely heed to those warnings or heed to that advice and making sure that you are staying on track with managing this blood pressure, just because of the high risk intensity for other components and things to have as far as heart disease. So that is blood pressure. Now we're going to be moving on to our second number. Our second number is cholesterol. So knowing your LDL and HDL. So LDL is also called low density lipoprotein, and HDL is high density lipoprotein. These are two types of lipoproteins that carry cholesterol in the blood. Cholesterol is like a fatty substance in your body that needs it to build cells and to produce hormones, things like that. But it can also carry it if it's unhealthy ranges, it can impact your body. So LDL, or the low density lipoprotein, is considered the bad cholesterol. And I say that with quote unquote, but it really transports cholesterol from the liver to the cells An excess of this is not great because it can also cause damage to our blood vessels, forming plaques, narrowing our arteries over time, and you're at much higher risk again for heart disease, heart attack, and stroke. So the optimal level for LDL, low density lipoprotein, is less than 100 is ideal. And that's less than 100 milligrams per deciliter. There are ranges for levels of LDL, and that's going to be on our show notes for you to understand. But bottom line is less than 100 is ideal for LDL. HDL, high density lipoprotein, is considered the good cholesterol. This helps to remove cholesterol from our bloodstream. The higher levels of HDL in our bodies, we have a lower risk of heart disease because it helps to keep our arteries clear. And this is a really good indication of, again, having that balance between LDL and HDL, but optimal levels for HDL, high density lipoprotein, is 60 milligrams per deciliter or higher is considered protective. So again, we want to make sure that LDL is less than 100. Optimal levels of HDL is 60 or higher. Again, is considered protective. So those are our two numbers for cholesterol, which is LDL and HDL. Again, if maybe your LDL is too high, HDL is too low, there are strategies that we can have to increase those numbers. Again, I'm going to go back to it is looking at your diet, making sure we're eating whole foods, whole grains, whole vegetables, whole fruits, limiting our saturated fat, our trans fatty acids, limiting sugar also can help that as well. But again, it's really looking at those saturated fats. So it's whole foods, getting enough exercise, and we'll talk about exercise recommendations here in a little bit. It's going to be aerobic intensity, aerobic exercise, and also some strength training, which we'll get into as well. Sleep is also a big factor of that, making sure you are getting 7 to 8 hours, if not more hours of sleep, depending on your body type and what your range is. But again, sleep is a huge component to our overall health and well-being. I don't think it gets enough attention, although it's starting to get much more understanding in the media that maintaining a sleep cycle is very, very critical to our overall health, and also managing stress. Stress is going to be a critical component as well. So those are things that we can help to manage that cholesterol. Again, if you have a high LDL and maybe a lower HDL, again, your provider, when you go in for that annual physical, may recommend some medication therapy. Adherence to that, if it is recommended, is going to be critical and important as well to lower your risk for all the other components that can happen. We're going to be moving on to our third number here. So the third number I want you to understand is blood sugar. You may have heard a lot about blood sugar in the media, or understanding what too much sugar in our bodies. A typical American diet has very high, much sugar content. But we're going to be also talking about fasting blood sugar, which should be under 100 milligrams per deciliter. And fasting means you have not eaten for at least a 10 to 12 hour period, for example. And some people say 8, but I typically try to go 10 to 12 for a fasting blood sugar to be under 100 milligrams per deciliter. And elevated levels of fasting blood sugar could signal that maybe you're pre-diabetic or even diabetic. If you have a blood test for this, you typically have to go into your healthcare provider during your annual physical. They're going to want to know what your fasting blood sugar is. So when you go in for that annual physical, make sure to ask them if they want you to be fasting before coming, if you need to have some blood work done ahead of time or during your appointment. So that is something to be considerate of, but it's really, again, wanting to make sure we understand what that fasting blood sugar is, can give us a good indication of how your body is processing sugars, that insulin response that we get if we have high sugar content. And too much sugar in our bodies is called hyperglycemia, which means your body can't make enough insulin or can't use it as well as it used to, which is normal aging. Maybe our bodies aren't working as well as it used to. That's very, very common, but it's just something, again, to be mindful of and to watch before it gets out of control. And over time, if maybe diabetes is not treated, that extra glucose in our blood can cause serious health problems in our heart disease, potentially stroke. It can damage our kidneys. It can damage our vision. So our tissues are very, very sensitive to high levels of sugar over time. That's where you get some of those complications from diabetes if it is not being managed well. So it's really, really critical to have us be managing this and watchful of it, just so you have an understanding of if there are some dietary changes you need to make, if there's medication you need to be on. Again, this is really making sure that we are in the best health as long as possible that we can be in. So hyperglycemia is too high of blood sugar, where too low of blood sugar is hypoglycemia. And this can also be very dangerous, just like low blood pressure. Hypoglycemia can cause us to feel faint and dizzy and not feeling so great. So again, that's something to also be mindful of. If you have a tendency to be hypoglycemic, that is not a good thing either. And that should be also managed and monitored. The other component that we're going to talk about, not just fasting blood sugar, which should be under 100 if you've been fasting, is called your A1C level or your hemoglobin A1C. And this is a percent of measuring your blood sugar levels over the past 2 to 3 months. It kind of gives you an average score, which is as a percentage. And so the A1C is a good test to measure what your blood sugar levels have been over time, where that fasting blood sugar is just a one point in time. It's just that day you go into the office or day you have your annual physical. A1C gives us a good indication of what's been happening over a specific period of time. So again, this is expressed as a percentage, and it can help us to really diagnose where your blood sugars have been over the last 2 to 3 months. And they want you to be around 5.7 or less. So again, your A1C should be 5.7 or less to be managed healthily. If it's above that, they're going to be talking about some other strategies to help you maintain your blood sugar, or there's some lifestyle changes that you need to be making, such as going back to diet, exercise, sleep, moving more, eating less, all of those kinds of factors. We'll get into more strategies later on in future episodes, and this is just kind of a quick snapshot of what we're going to be looking at for managing some of these numbers if you wanted to get started right away. However, again, if you're changing anything in your overall regimen, make sure you're talking to a healthcare provider. So the fourth number that we're going to talk about is waist size and waist to hip ratio. We all know that the scale can be a fickle thing and number is just a number. However, the number of weight does not give us the whole big picture. And it doesn't let us understand body types, muscle size, how much fat you're carrying, all of those other components. So waist and waist to hip ratio are really important other things to consider and know and understand what the ranges are where you should be at. For example, waist size and waist and belly fat is really linked to, and why we should care, belly fat is really linked to other serious conditions. Again, stroke, type 2 diabetes, things like that. So measuring your waist is really an ideal way to understand how much body fat you might have. And it's a key factor for understanding risk factors for chronic illness. It's not the most fun thing to do, but yet it's a very insightful piece of information to have for your overall health. So how we measure belly fat is you're going to take a tape measure. You're going to measure just under your ribs and right above your hip bones at the central part of your abdomen. And for women, this should be 35 inches or under. And for men, this should be 40 inches or less. So again, it's under 35 for women, under 40 for men. Making sure you are measuring. And again, the other thing to measure when you're thinking about measuring that is taking that tape measure around your stomach. And it's when you breathe out. So we're not sucking in, we're not trying to flex our muscles as we measure our waist. However, this is just getting a good sense of where we're at. It's a number to understand and to pay attention to again, overall lifestyle and longevity. The second one is going to be waist to hip ratio. And this is important to understand because the size of your waist and the size of your hips, that ratio, again, has been linked to other chronic conditions as well. So when we want this measurement, we're going to measure our waist size. It's just like I mentioned before, you're going to go below the rib, above the hip bone, or the top of your pelvis. And then you're going to have the hip circumference is going to be the widest part of your buttocks or your butt. And you're going to measure that parallel to the floor. Again, you're going to take those two numbers. You're going to take the first number, which is your waist number, and divide it into the second number, which is your hip circumference. And that is your hip measurement or your ratio. And the World Health Organization defines ratios for over 0.85 for women and over 0.9 for men to be at a substantially increased risk for obesity-related illnesses such as diabetes and also heart disease. So really understanding, again, the ratio that we're aiming for is a less than 0.85 and less than 0.9 for men. 0.85 for women, 0.9 for men. Higher than those two numbers, you're going to be at substantial increased risk for more chronic diseases, metabolic disease, heart disease, diabetes, all of those factors that we've been talking about before. So these ratios are going to be on that in the show notes, on the document I have for you to print off and record all of these numbers for yourself. Again, this is something you can bring into your healthcare provider. If you do some of these numbers before your appointment, you can bring in that sheet of paper and say, this is what I've been doing. This is what I'm looking at. how do we talk about strategies to better these numbers if you're not in the ideal range that you'd like to be in? This is a way for you to kind of take charge and be in control of your healthcare. And last but not least, the last number we're going to talk about is resting heart rate. And this is super important as well, just because it's going to look at what our heart is doing at that normal resting level. So resting ranges that we have should be between 60 and 100 beats a minute. So regular exercise, especially cardiovascular exercise, can help to lower this number and improve your health. Making sure you're relaxed when you're taking your heart rate. I recommend doing it right when you get up, right when you wake up in the morning, take your heart rate. And how you take your heart rate is you're going to take your index finger and your middle finger on your right or left hand, whatever you choose. And one way to look at that is going to be on your carotid artery, which is on your neck, on the side of your trachea where you swallow. Right on the side of that, you'll be able to put your two fingers there. I'm doing it right now. And you can feel for your pulse. The other one to take it is on your wrist. So you're going to take it's on the thumb side of your hand. Turn your hand over, look at your hand, take your thumb, go all the way up to your wrist, and you should feel your heartbeat right in that wrist level, again, with your two fingers, your index and your middle finger. If you're driving, don't do it now. Wait till you get home. Understanding your normal resting heart rate is critical. So that is going to be between 60 and 100 beats a minute. Some people might have lower heart rate. If you're in really, really good shape, it's pretty common to be lower than 60. And a high resting heart rate is a really fast heart rate, or heartbeat over 100. And that is called tachycardia. But we want to make sure we're understanding, again, just that range of your resting heart rate. Take it right when you wake up in the morning to understand where you're at, give you a good indication of what your heart is doing at rest. Again, if you're lower, which might be an indication of that you are in good shape. However, if that's not true, then we really need to understand why you have a lower heart rate, and that can be some serious things as well. If you, again, have a too high a heart rate, even at rest or just waking up in the morning, that may be indication of some other components as well. So making sure that this measure, you are measuring just to give a baseline of where this is. They may ask you if you go in for your appointment or annual physical, and you can say, look, my resting heart rate was a little bit high. They may have you do more testing just to make sure that everything is A-okay and functioning as properly as it should. So again, high heart rate is over 100 beats a minute, and lower heart rate is less than 60 beats a minute at rest. Again, taking this when you are just wake up in the morning, or maybe you've been sitting down for a while reading or watching TV, what have you, and getting a good number where that is. Again, these ranges are going to be on that document on our show notes for you to take a look at. This is a great thing to have understanding. This is our last and final number, your resting heart rate, making sure you are checking that as well, and a good indication of where you are with that. So there you have it. We have part one of knowing your numbers. We just went through the 5 numbers I think are pretty critical and foundational to our overall health. I went kind of fast. Sorry, I talked kind of fast. But take this time to really assess where you are, and remember these numbers can give you power to take back control of your health. Again, it's really a good indication that you understand where you are with your health, specifically at midlife and beyond. So it's important to post these numbers, keep track of them. You can recheck them if you are changing some lifestyle habits, but again, don't change anything too drastically without talking to your healthcare providers. And these are recommendations that you've heard here today. If you don't have a healthcare provider, I would highly recommend seeking out and finding one and having a physical at least once a year. In future episodes, we'll cover more about exams and what to cover annually, what other exams we should be doing and monitoring over time. But for now, identify these values for yourself. Take control of your health. If you've enjoyed this episode, please don't forget to subscribe, share it with a friend you think might need to understand this information, leave a review. If you have other topics you want us to cover, please let us know. We're always looking for more feedback. Until next time, remember to take care of yourself and keep unmasking your best midlife health. Thank you so much. That's a wrap on this episode of Midlife Unmasked. I hope you found inspiration and a few key takeaways. If today's episode resonated with you, please be sure to share it with someone else that could also benefit. And don't forget, this podcast is here for you. If you have a topic or a question you'd like us to explore, please send it our way. Your feedback helps us reach even more listeners on this shared journey. You can find us on social media and our website, midlife-unmasked.com. That's midlife-unmasked.com. And the links are also in our show notes. Until next time, keep unmasking your potential, embracing the possibilities, and living your best midlife with courage and confidence. Take care and see you next week.